All right, hello. So I don't even know if I want to say my title thing, or you know what? I'm gonna do. Yeah, I'm gonna do that. So hello, this is Marie Diaries. Excuse me. This is Marie Diaries. And I'm here to do a video. All right, so we're gonna get into this little thing, because it's really aggravated me and it's triggering me because I've been dealing with this since birth, from what I know of. So I've been meaning to do this, but it's been so much going on that on the background on my end, like stuff that I've been having to deal with personally, like as far as like making sure I have a roof over my head. I have been trying to make sure I keep a job. So it's just been so many like distractions trying to go on, trying to distract me to that, trying to like, basically deviate my attention to what I've been trying to do, even if I've been trying to do multiple things at one time, even though I'm only one person, but it's okay. So I do want to start a new channel, so this probably will end up getting put on there too. I don't know, I might have to cut this part out in the beginning, or I might just leave it. But so yeah, it was like a little bit of an elephant in the room because I was like, I be so on YouTube. And for me personally, I'm gonna be shuffling cards, but I'm not gonna be pulling no cards for this video. But I just need to shuffle. Um, so yeah, YouTube has this thing where they're allowing a lot of people, um, and even people that's not even dealing with this, which is really like alarming. I don't know if it's any way for them to do anything, any way to patrol it or stop it. But I feel like it's really, it's really. I don't even know how to word it right now. But for people to use something for their advantage that they're not personally dealing with, like when they use the videos, when they use making videos to, basically accommodate views, accommodate, getting money for that views for the video and stuff. And then another thing, when people be doing videos and they're not properly putting out information about stuff. They're spreading false narratives and basically false narratives, false information. So I'm making this video in regards because I've been meaning to do this. I had wanted to do this like a few months ago when I was still at Amazon, but like again, I said I was dealing with all the stuff going on with that, and so my mind was just not really focused in what I wanted to do. All right, so this video is going to be regards to, like, basically, let's start off with the basics of my understanding of what I'm gonna say. What does HIV mean? So before I even clicked on the Google, you know, its abbreviation is HIV. So it's human. What I said was human immune virus. Okay, but it actually says something more in depth online, which I'm looking at right now. So, what is HIV exactly? And what is AIDS? Because there is a difference between HIV and there is a difference between AIDS. They're not the same thing. Okay? And people, that's a big, how you say, that's a big stereotype. That's a big I guess confusion with people, because I feel like in the beginning of when when HIV came out, it was more people was using it as saying AIDS, because I feel like, in the beginning, like around, like, I don't know. I guess it really originated in the 1980s. And when I say originated, I don't even know how. Like, I don't even know where to, like, because I haven't researched that. But for what I know, it's like, because from my mom, I know she was living in the Bronx. She was living in a highly toxic area, environment where she was at, and she was already, yeah, look, I don't mean to show this, but because it's not even, I'm not trying to pull cards, but you got karmic relationships at the back of the deck. um so that definitely was karmic energy back there, whether it was karmic energy back then, whether she knew or realized it. um But anyways, yeah, and I see 9/11. I see 9/11 on the clock backwards. I see 11:09, but I see 9/11. Um, I don't know. So I'm on this spiritual journey. So just bear with me. So 1980s. Yeah. So back then my mom was doing drugs. She was doing drugs. Obviously she had to been sharing needles or whatever. I felt like because this had to be the way that she conceived AIDS back then, which is now HIV if you're doing what you need to do. If you're handling what you need, if you're handling and taking care of what you need to do, you will not have to deal with AIDS. Okay? So I feel like that's the main misconception. That's the word I'm trying to get. Misconception in regards to HIV and AIDS. So what is HIV and what is AIDS? HIV is human immunodeficiency virus. If you break down deficiency is when it has to do with the blood cells. I believe it's the white and the red blood cells, but I'm not 100% sure. Um, and God rest her soul, Hydea Broden. That's why I wish she was. I wish she was still here. I wish that was my, like I had that on my list, like kind of like low key on my list to like actually meet her one day. So it just like it still hurts to know that she's not here with us anymore. And I kind of feel like I'm left alone by myself, even though I know I'm not. But I looked at her in so high regards because she, like, I don't want to get emotional, but she was able to talk about HIV and everything with like with no issues, no problem. It like it was something that came to ease for her. And I feel like I've been getting more to that, but I know that I'm not all the way there yet because every time I go to talk about it, I get emotional. Like I get upset, I get emotional. So, ooh, woosah, 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 woosah. But anyways, I feel like I'm getting emotional too because I'm thinking about her. So, and I just feel like I just thought she was gonna be here longer, and like I was gonna have that chance to meet her. Um, hold on a minute. All right, I had to bring myself back together. So HIV, when I googled it, it says human immunodeficiency virus. So basically, it's a deficiency when it comes to the immune system of the human body, which has to do with the red and blood cells. And what is AIDS? AIDS has three, which is it's a four acronym. HIV is a three acronym. AIDS is an acquired immunodeficiency syndrome. HIV is the I feel like it's the beginning. AIDS is the end if you let it. Basically, to me, I feel like which it is because at this point in age, where to be in 2025, if you allow yourself to go on so much time without getting medically seen, medically diagnosed, um, doing what you need to do, obviously, I feel like it is going to, I'm thinking rapidly progress to AIDS, which is acquired immunodeficiency syndrome, because you're not doing the needed medical stuff that the medical steps, what you need to do. So yeah, it would end up to AIDS, but that is not what it starts off as. I feel like that's confirmation with the pop. It starts off as HIV. So like, you know, we know that people are out here having sex, whether they're of the opposite sex, whether they're of the same sex. But it's like if you're not even taking the necessary to go get yourself seen, whether it's just a regular checkup or you're just going to the, like, you know, that the smaller clinics, the urgent clinic. Because I don't know if, I think urgent cares, they could probably do testing for that too, or for all STDs and everything, but I'm not really sure. That's something, excuse me, that's something I could maybe even do or something, or find out or something like that. I don't know. I could look into doing that. Um, but yeah, if you're not doing the necessary stuff ahead of time, so if you being intimate with somebody and you know they don't, you're not, both of you are not telling each other what you got going on, then you letting so much time go on before you get yourself looked at, then yeah, it could rapidly, like I said, progress to AIDS. Because in this day and time, 2025, I don't know how fast. That's something I could find out or work on finding out too. Is like, how fast would it take from it to go from, you know, it just being regular HIV to AIDS? Like, I'm assuming it could go probably fast. I don't know. I just don't know. I think like it would depend on the body too. Like what else you already got going on? Cause I feel like for my instance, that's the only thing I really had going against me was being born with HIV. I didn't have nothing else going against me. Like, I didn't have no issues with my liver or my heart or none of those things. God, you know, God willing, I did. You know, thank God that I didn't. I did have, like, you know, other stuff going on because of me being a premature baby, which was like ear infections, and I had cerebral palsy in my feet, so I had to deal with that. But I didn't have any other like internal stuff going on besides that. But it was dormant. I don't feel like I talked about it in that way a lot. It was dormant because I didn't find out that I was, you know, positive until I was what grade I was in. I remember that day so vividly, like it was yesterday. I remember going to the doctors with my mom, and we went to the doctors because I had thrush in my mouth, and I don't feel like I wasn't really feeling well. I felt like I was feeling okay. I just end up coming to my mom and telling her, showing her that I had thrush in my mouth, and it was at the top, because that's usually, they say, I don't know if babies still get that today, but they was back then when I found out, is that's what babies used to get, like, or babies get. I don't know if they still do, so because I don't have any kids, so I don't know. But and I don't even think none of my nieces or nephews or my cousins or anybody that I grew up around, I don't think they had that either. So I just know that they said that in the past, that's something that kids could get. I guess that would depend on what's going on. Like, if something is not I don't know if it has something to do with something not being clean or something. I don't know how a baby get thrashed, but I know it correlates with babies. It normally correlates with babies. So when I went to the doctors with my mom, that's how we found out, because I had that at the time. I had that going on. Um, and when they did testing, because I think they did testing and they wasn't finding nothing else. And then I think they end up testing, somehow they end up telling me I had pneumonia. And then when they found out that I had pneumonia, that's when they found out that I was positive. But it had been dormant all that time, from birth until when we went to the doctors. When I went to the doctors with my mom that day, but we, like I said, we only went because I had thrash in my mouth, and I don't, like I said, I don't think I was feeling any other like sickness, or I wasn't feeling sick at that time, or maybe I was a little bit under the weather. I don't remember, but I know we went to the doctors because of that, because we both didn't know what the hell was, why that was going on, why that was happening, because she knew I would have earaches and stuff like that, and you know, sometimes I have upset stomach depending on what kind of certain foods or certain stuff that I try to eat or something. I don't know. And maybe that was kind of signs too, that's what it was, but um yeah. So that's kind of a side note, but let's see. Let's see what Google says over here. 15 minutes in. It says HIV is a virus that attacks the body's immune system. The only way to know if you have HIV is to get tested. There are many ways to prevent HIV using PrEP, which is PrEP, PEP, which is PEP, and condoms, and never sharing needles. HIV treatment helps people live long, healthy lives and prevent HIV transmission. So uh that was put up there. Googled. It was put for January 14th, 2025. Let's see what else it says over here off to the side. It says HIV damages the immune system and interferes with the body's ability to fight infection and disease. HIV can be spread through contact with infected blood, semen, or vaginal fluids. There is no cure for HIV/AIDS, but medications can control the infection and prevent disease progression. Some people with HIV develop flu like symptoms 2 to 4 weeks after getting the virus. People taking HIV medications may not have other symptoms for years as the virus multiplies and destroys immune cells. Symptoms can develop such as fever, fatigue, and swollen lymph nodes. Untreated HIV typically turns into AIDS in about 8 to 10 years. So that's a long time. So I actually probably was at that point, or getting close to it, maybe, because like I said, I was born with it, so I believe I must have been like 7. I know it happened after my mom passed away. That's when I ended up finding out was after. It was after she passed away. My mom passed away in the in March of 1991, so I was 7. So it must have been like that following year. I really don't remember exactly, but I know I was still in elementary school. Um, and I know I know when I went to the doctors, find out I was still living with my mom that raised me. Her sister, I was living with my mom's sister who raised me. So I was still in school. Yeah, I believe I was in what grade was I in? I was at 30 school. So I know I wasn't in the third grade. I was either in the fourth or fifth grade when I found out. Yep. It was either the fourth or the fifth grade. Yep. Okay, and it also says no cure exists for HIV/AIDS, but medications can control HIV and prevent disease progression. With treatment, most people with HIV in the U.S. don't develop AIDS. What else? Fewer than 200,000 U.S. cases per year. Um, let's see some other stuff over here. They got a lot of stuff in Wikipedia, but I don't know. I'm 18 minutes in. Okay, let's see. Let's go to Wikipedia for HIV. It says this article is about the virus. For the infection caused by the virus, see HIV/AIDS. For other uses, see HIV disambugation. Ambugation. AIDS virus redirects here. For the computer virus, see AIDS computer virus. What? Okay. It says the human immunodeficiency virus HIV are two species of lint virus, which is LENTIVIRUS, a subgroup of retrovirus that infect humans. Over time, they cause acquired immunodeficiency syndrome (AIDS), a condition in which progressive failure of the immune system allows life-threatening opportunistic infections and cancers to thrive. Without treatment, the average survival time after infection with HIV is estimated to be 9 to 11 years, depending on the HIV subtype. I feel like they say HIV subtype because sometimes it be um, other factors. But it says the subtypes of HIV include two main subtypes known as HIV type 1 and HIV type 2. These subtypes have distinct genetic differences and are associated with different epidemiological patterns and clinical characteristics. Wow, I didn't even know that. Let's see. HIV. Okay, so we did one. Or no, we didn't do one. So HIV 1 viruses can be further stratified into groups M and O and P. Among these HIV 1 group, M viruses are the most prevalent, affecting nearly 90% of people living with HIV and are responsible for the globe are are responsible for the globe AIDS pandemic. Group M can be further subdivided into subtypes based on genetic sequence data. Certain subtypes are known for their increased virulence, which is spelled VIRULENCE, or drug resistance to different medications used to treat HIV. HIV 2 viruses are generally considered to be less virulent, and less transmittable than HIV 1 M group viruses, although HIV 2 is also known to still cause AIDS. One of the prevailing challenges in the pursuit of effective management of HIV is the virus's pronounced genetic variability and rapid viral evolution. Wow. Mm. Okay, I'm not about to read all this right now. I had to do a whole nother video. But let's go back. Go back, go back, go back. Is it going back? Nope. Go back. Okay, so it says in most cases, HIV is sexually transmitted infection and occurs by contact with or transfer of blood, pre ejaculate semen, and vaginal fluids. Non sexual transmission can occur from an infected mother to her infant during pregnancy, during childbirth, by exposure to her blood or vaginal fluid, and through breast milk. Within these bodily fluids, HIV is present as both free virus particles and viruses within affected immune cells. Research has shown for both same-sex and opposite-sex couples that HIV is not okay, excuse me. Research has shown for both same-sex and opposite-sex couples that HIV is not contagious during sexual intercourse without a condom if the HIV positive partner has a consistently undetectable viral load. Now I gotta read that again because I don't know why I'm reading like that, but hold on. Okay, let me start from the beginning. It says in most cases, HIV is a sexually transmitted infection and occurs by contact with or other transfer of blood, pre ejaculate semen, and vaginal fluids. Non sexual transmission can occur from an infected mother to her infant during pregnancy, during childbirth, by exposure to her blood or vaginal fluid, and through breast milk. I don't even know if my mom gave birth to me, or I'm assuming I feel like she gave birth to me, cause I don't think they had no C sections back then, and then I was so small, so I think she literally gave birth to me. Mm-hmm. Wow. Damn. Oh, yeah, that's crazy. Mm-mm-mm-mm. It says within these bodily fluids, HIV is present as both free virus particles and viruses within infected immune cells. Research has shown for both same sex and opposite sex couples that HIV is not contagious during sexual intercourse without a condom if the HIV positive partner has a consistently undetectable viral load. What is viral load? Viral load monitoring for HIV is the regular measurement of the viral load of excuse me. Viral load monitoring of HIV is the regular measurement of the viral load of individual HIV positive people as a part of their personal plan for treatment of HIV/AIDS. A count of the viral load is routine before the start of HIV treatment. Various viral load tests must or might be used, might be used. One way to classify tests is by whether it is a nucleic acid test or a non-nucleic acid test. Variation in cost and the time it takes to get a result may be factors in selecting the type of test used. Viral load monitoring is used by HIV positive people to develop a plan for their personal treatment of HIV/AIDS. A count of the viral load is routine before the start of HIV treatment. If the treatment is not changed, then viral load is monitored with testing every 3 to 4 months to confirm a stable low viral load. Patients who patients who are medically stable and who have a low viral load for 2 years may get viral load counts every 6 months instead of three, which is what I do. I get my viral load checked every 6 months because, again, I've been getting my blood tested since 1990. It was before I got in high school, so it was like I said, fourth, fifth grade. So that was like 1994, five, six, one of them. It says if a viral load count is not stable or sufficiently low, then that might be a reason to modify the HIV treatment. If HIV treatment is changed, then the viral load should be tested 2 to 8 weeks later. And that's the thing too. Like in the beginning, my viral load was not undetectable, but they had to get it to, I don't know if it's like what we saying would get it leveled or something. I don't know. I don't know if that's really how it's supposed to be said or worded or whatever, but I feel like it took like not even that many years. It took like only like between, I think like 1 to 2, maybe 3 years, and then my viral load started becoming undetectable. Because I constantly took my medicine. Like in the beginning, I had to take more medicine. Like I had to take it 3 times a day. I had to take I had to take more in the morning, I think, and then the less was at night. No, was it the less was either the middle of the day or it was nighttime. Um, and then it got changed. Like in the beginning, I was taking Viracep and Camavir. Then that started the amount of that started to go down. Then I think I took, what was it, Travada, and now I'm on Big Tarvy. So I changed the type of meds I took like 3 different times so far. So now I'm just down to the Big Tarvies, which I take once a day, every day, once a day, once a day for every month. Once a day every month. Shit. No, one pill a day for the whole month, but it's like it's the same one pill every day. Um yeah, so I read that. What else? 29 minutes. Okay. Previous time treatment. Let's go back. What else? What else could I put or read right now? It says HIV affects vital cells in the human immune system, such as helper T cells, specifically CD4 plus T cells, macrophages, and dendritic cells, which is spelled dendritic cells. HIV HIV infection leads to low levels of CD4 T cells through a number of mechanisms, including uh, pyrophagy, pyrotopsy of abortively infected T cells. That is spelled pyroptosis. That's pertaining to the. I'm breaking it down medically because the class I used to take in college, the medical terminology class. I always be wanting to break down the words, the medical words. Prior is pertaining to prio. That sound like that's the blood or something, or the something. It says it. So pyroptosis or topsy. No, it's tosi something. Pyroptosis is a highly inflammatory form of lytic programmed cell death that occurs most frequently upon infection with intracellular pathogens and is likely to form part of the antimicrobial response. This process promotes the rapid clearance of various bacterial, viral, fungal, and protozoan. Okay. Okay, so it said including pyroptosis of abortively infected T cells, and the other one is apoptosis. Apoptosis. That's the same as the proto. It's okay. That is of unaffected bystander cells and direct viral killing of infected cells and killing of infected CD4 plus T cells by CD8 plus cytotoxic lymphocytes that recognize infected cells. When CD4 plus T cells numbers decline below a critical level, cell mandated immunity is lost, and the body becomes progressively more susceptible to opportunistic infections, leading to development of AIDS. And that's basically because you're not going to get treatment. You're not taking medicine. You're not even taking a step to go to the doctor to see if you got something going on. Um, and I feel like if in my warning, my alert sign was when I got the thrash in my mouth. So if I would have never got thrash in my mouth, who knows what it would have happened? Who knows if I would have got some other kind of sign to know what was going on with me? Yeah, yeah. But the thrash was the first sign. But then when they found out that I had pneumonia too, that was a sign too, because they probably was like, why is you, what's, if if you all, you know you first you got thrash, now you coming up with pneumonia. So that's what made them look further, I guess, or that's what made them do the test, like, to check me. Yep. And sure enough, when they came back, that's what it was. I found out that I was HIV positive. So like I said, though, if I wouldn't have got thrash and pneumonia, I don't know what other signs I would have got that I had something going on. I don't know what other signs would have been given to let me know that something was going on, because I sure enough ain't had no clue. So I wouldn't knew. I wouldn't have knew. I didn't know nothing. Wouldn't know nothing. Um. All right. So we 34 minutes in. I'm gonna try to make more videos of this, and I feel like this is gonna be the first video for my channel, because I do want to have a channel that's directly for. I've been wanting to do that, but I just, like I said, I've been having all this other stuff going on. I'm trying to make sure I have a roof over my head, even though, you know, I'm here by myself now. I don't have my dog no more. God rest his soul. My baby gone. But I've been trying to keep a roof over my head. I've been trying to keep income coming in. Um, that had been going good for a while. So it's just, you know, it's been going good, and I'm okay for the moment, but I'm not satisfied. Like, I want to be, um where that hair went. I want to be working again, or I want to be making my own money on my own, you know, off my own dime and stuff. Like, I don't know. I don't know what God has for me coming up, but I hope it's really, 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 really good. I hope it's more benefit than anything that I don't benefit from already. But yeah, I did want to make, like, I had been wanting to make a channel while I was even still at Amazon. I had wanted to start my channel for just, you know, focusing on my story of me with HIV and stuff. I've been wanting to do that, but it's like I said, I've been so having so many other unnecessary distractions and stuff, so I haven't been able to do that. I mean, I know I do have a couple videos on my channel that I have right now, but I want a channel that's just dedicated to whatever, you know, even if it's just me doing informal videos like this, to get people to understand what it is exactly, so to not always be so fucking, excuse me, to not always be so negative and judgmental of people, because that's like me being judgmental to people that got cancer and stuff. Like, and it's so many forms of so many different cancers, so it's like I can't even do that, because I know where they coming from. Like, and I've been dealing with this since birth. Like, and it ain't been no smooth ride. Like, I feel like it has been smooth, but it's been more up and down. I'm more since, like, you know, since 2020 and a little bit before or whatever. But I mean, you know, I had to take, you know, responsibility and accountability for everything, you know, the good and the bad. So I mean, it is what it is, but like I said, I'm not out here like judging people. Like, I literally worked in healthcare. Now, I didn't work in healthcare because of what I personally have going on. I got into healthcare because I wanted to be able to help people. Like, even if I'm not, um, you know, how you say, because I worked in healthcare. So I had my home health aide, I had my CNA, and I had my PCA. So, in whatever way that I could help, I wanted to help people, because I already knew, like, you know, I know I was getting help. I've been getting help and stuff with me, but it's like, and then I wanted to, like, pay it forward. I feel like that's what it's been like all this time. Like, I just wanted to pay it forward, like, knowing that I've been getting help with me this whole entire time, like, since I came out my mom's womb, and when that before that even got diagnosed. Like, I've been going to the hospital that I've been going at since I've been living in this city, since I've been a kid, and I've been going there for like ever. Um, so I think I got into it too because I wanted to pay it forward. Like, if I've been getting help with myself, with everything that all these things that I did not ask for. I've been getting help with all of that. Like, I wanted to pay it forward, and I liked when I was in healthcare, I like to sit with them, and, you know, talk to them, get to know them, keep them company. You know, give them somebody else to, like, you know, talk to, if they feel like they didn't always have somebody to talk to, or they felt like they always didn't have somebody that they felt like that was family or something like that. I always wanted to be of help, of servant to people. That's what I feel like, in the littlest or the biggest way possible. So, and I always felt like it has not been a big way. I feel like it's always been little stuff, like, you know, but I still feel like it's helping. So yeah, I'm gonna just try to figure out what I'm gonna make my channel. What's the title, or like what's the name of my channel gonna be? Because I have been thinking about that too a lot. But I know I had wanted to start another channel directly for that, but I just don't know what to name my channel yet. So, but this will I'm gonna add this on my channel that I got now, but I'm gonna add it on the new channel whenever I figure out what I'm gonna make the name of it. So I don't know, but I'm gonna figure it out. So I'm gonna go ahead and leave this here because we getting into an hour, and this don't need to be an hour, but I will try to do more of these videos because even though I feel like I know some stuff about what I got going on, I feel like it's always way more for me to learn, and maybe even be able to teach somebody that don't know what they talking about, like, or they not understanding it, and or somebody's giving them some kind of misleading false information, um or any of those things. So yeah, I'm gonna go ahead and leave this here, and I will be trying to do more of these videos in the near future. I will definitely try to do that.